You make me think of, I often think it's interesting that low and middle income countries potentially have the opportunity to really leapfrog where the developed world is, particularly as it relates to digital health, because they're not strapped with lots of legacy infrastructure, including EMRs. So I'm very curious to hear what the panel thinks about, in a lot of cases, some of these digital health capabilities are going to be brand new. So what sorts of things do we need to do around evidence generation and proving their value and ability to scale before they're adopted?
In my opinion, is it on? Yeah.
Oh, yeah, there it is.
In my opinion, one of the first positions we're going to have to take to be able to get around to gather data, gather evidence, to validate this position, or, God forbid, to invalidate our position, is to admit that we don't know enough. Once you start off from a position of we don't know enough, you are going to, in a very adaptive manner, collect data and use it. Meaning, okay, I don't know enough about this stuff. So the little bit I'm going to do initially, I will observe it a bit more critically. I will take some data from it, and I will use that information to assess if what I'm doing makes sense, and then proceed. The challenge with that, which is in my opinion, part of the biggest challenge with the way development is currently structured across most of the world, is that it is slow. It's not quick to show the desired result, and it's not a very exciting way to do things. But in my opinion and in my little experience where I've used that kind of system or methodology to do things, each iteration is better than the last. And by the time I am comfortable with what I have this huge quantum of information that allows me not just to chart and track the evolution of what I've done, but I can actually tell someone, this is where I made the mistake. A long time ago, I used to build websites. This is in the time when we used to handwrite HTML and handwrite Java code. Now, anybody who's ever done that will tell you that you would have to be crazy to write 2,000 lines of code before you run it. So I'll write a few lines of code, I will run it, and make sure the page loads as I want. So I know this code gives me the page with the black background. Then I'll write the next piece. And where it doesn't work, I use the information about it not working to inform the next piece. So I would say we need to start from a position of we don't know everything, or we don't know enough.
Yeah, I would agree with that. I also think when you look over the history of the digital health and mHealth space, one of the big causes for hand-wringing has been the lack of an evidence base. There's been enormous hype around the potential of these tools to improve health outcomes, to strengthen health systems, and next to that mountain of hype, the actual evidence has looked a little bit like a molehill, and so that and I think that's still the case. I think that the evidence base showing very directly the impact that these tools are having on health system outputs, much less health outcomes, is quite thin. And I actually have started to wonder if it's a little bit self-defeating, if people feel like they need to isolate the impact of the digital tool on the change that's seen in the health system. And I've just started to wonder if this is maybe a little bit self-defeating, that in fact most digital tools are introduced in the course of some sort of business process change, and a change in the way things are done. And so you're probably not going to isolate that, the specific role that the digital tool played, and maybe you shouldn't be trying to do that as much, and thinking about it overall in the course of the larger set of changes you're trying to institute. And I think it's often pointed out that in health, as in anything else, if you introduce a fantastic tool onto a really faulty process, you're not going to get huge change. So, yeah.
Well, I will say, I think for the donors, evidence is vital, and be able to say, because somebody's going to say, okay, you spent so much money, what do you have to show for it? And we do need to be able to show something for it. I think what we have to do, though, is work with everyone involved to say, well, what metric matters and what time frame matters. If you want to end a global pandemic in 2 years, no, we're not going to. We're not going to show you that. But we can show you that we have made some incremental results. And in the health sector, it's fortunately actually much easier to quantify than in some of the other sectors of development work, because we can say, well, how many kids got vaccinated? How many women got delivered in a facility? How many people died? How many people didn't die? How many people got their medicine? And if we can demonstrate that a new system leads to that, that's useful. My only caution, and this comes from my own experience working with my personal physician when they introduced an electronic medical record. We've known each other long enough that he felt comfortable swearing in front of me. And when it was new, it drove him crazy, and it was slow, and he made mistakes. And now I go to see him, and it's fantastic, and I can go online, and I can see my blood results before he sees, all that stuff. It takes time before you really realize the value of that investment. So that's probably where we need to sort of strike a balance between how long is it going to take for us to really realize the value of some of these investments.
Takes a little bit of patience, right, sometimes. I'm curious to talk a little bit about how you think, digital health strategies, public-private partnerships, donor funding, how that might need to be different depending on the different economic status and scenarios that are going on in the individual countries where we're attempting to make a difference.
I think we're still at a point where there's a lot of room for innovation, and we as a donor, we get courted by innovators, and some of them have some phenomenal tools for us. But some of those phenomenal tools are to help us get through a transition period to someplace we need to be. But those tools could be valuable in the short term. I think it's the thing we don't know that we haven't thought of. It's the idea, I agree that we thought that the telecoms would be running everything. We may still get back to that. And it may just be that the first time we ventured into that water, it was too soon. But at the meeting I was at last week when I was presenting this, one of the ideas presented was, well, what you need is a cloud service. Well, who has a cloud service? Well, Vodacom has a cloud service. And I thought, you don't want the phone company to have everybody's data. And I thought, well, and there could be, everybody has a computer in their pocket, and sometimes they have two computers in their pocket, and it's all connected to somebody up there. And if there's a way to get over the privacy and encryption issues, there may be. What I don't know is what's the incentive to Vodacom to get into that space, and if there isn't, it's not going to happen. But to an outsider, it looks like, well, here's somebody that could help us solve a problem. But I think what we heard before, and we've heard many times before, is industry, the private sector is not going to get in unless there is something there for the bottom line as well. And I think that's where what we need is a sort of a dialogue of what's possible, what's not, what door to knock on, what not to bother with, maybe today, but to come back in a year.
Yeah.
I was going to say, I think I go back a little bit to the point I made before. When you think about the different places that countries are in economically, and not only this doesn't have to just be about per capita GDP, but the composition of the economy, which I do think matters a lot, and how big and active the private sector is, how big a role you might be able to expect them to play. But I wanted to mention one thing that I think is very important, and actually Shipo brought it up earlier in talking about Nigeria, that I think even countries that are relatively low resource can get much better private sector involvement through better governance structures. And this is an area where I do think we're seeing a lot of progress in many different countries. Nigeria is a good example of it. Rwanda is a good example of it. The Philippines, where you have countries that have built very robust governance structures for their digital health and an overall digital health architecture into which other various solutions can plug in that are based on common standards. That the achievement of common standards by itself is a big incentive to the private sector to start participating in a sustained way, because they need that predictability. But I actually think that governments focusing on building a strong and inclusive governance structure in digital health can actually make a big difference for countries that are, both more developed and less developed. And yeah.
To a large extent, the nature of the digital health strategy or any other strategy, or the nature of the PPP engagements, or just about any other engagements, will vary from each country, and in some country from the subnational components. It would vary across depending on all kinds of stuff. If you have a country where they have low resources and that low resource situation has impacted on their educational sector, so they're not churning out very good graduates or school leavers, and so there's not a lot of capacity. It doesn't matter if you take $2 billion or $4 trillion into that country, you would spend a lot of your money shipping in experts from out of the country. The minute you pull your experts out, everything will collapse. But there are then countries with a huge bit of resources, but because those resources are not appropriately managed or appropriately stewarded by their governance structures, so they do have resources, but things are not very good. There are some countries where there's money, there's good education, but there's some political instability. And so because of that kind of political instability, talent is quick to get out of the country. So it will vary from each situation. But like Brandon said, if you are able to start from the public sector and put in place some sort of governance that is strong, transparent, and shows commitment to do things right, chances are you would be able to attract the appropriate type of support to build your digital health strategies. The digital health strategy work in Nigeria started when Dr. Partey was the Minister of State for Health. He walked across the Federal Secretariat and went over to the Communication Ministry, and they had a conversation, and they felt technology is what would enable Nigeria to leapfrog our health challenges, particularly infrastructure. We need to get this done. Maybe if we didn't have a Dr. Partey, we may just be starting that journey now. Who knows? So it would vary from each country, it would vary from each situation.
So, we've talked about governance. We've also talked about the fact that we need national strategies. I think that fits really well with Trevor's point this morning around health as infrastructure. And when you bring in the digital element, I think infrastructure becomes even more important. So I'm very curious to hear what the panel thinks about how do you link the national strategy around health as infrastructure to the ICT strategy and all of the other pieces of the puzzle that you need to put in place to make digital health possible.
Yeah. I particularly like that question because, and I'm going to use the Nigerian example. When we're working on developing the digital health strategy for Nigeria, a lot of other policies, strategies, and pieces of work that existed in and out of government were considered. Things like the Broadband Master Plan, the ICT strategy, the National Health Development Strategic Plan, the health policy, because we realized very early in the game that technology is not the end. Technology is a service, is an enabler. If it was possible for me to scream really loud and have my friends in Nigeria hear exactly what I'm saying, and that message hopefully will not get intercepted by any of you in this room or anywhere else, then I wouldn't need a phone, would I? So you bring in technology and you implement to meet a need. Now, because we took that approach to things in developing the strategy in Nigeria, the attitude was, there's something we need to achieve. We want to use digital technologies to help the achievement of universal health coverage. The idea was not to deploy digital technologies in health. Yeah. So to a large extent, you need to contextualize these national strategies within what exists. There's nowhere where they've developed a digital health strategy and they've implemented or started implementing with some level of success where they didn't have a use case or a couple of use cases that resonated very well with the larger health sector. It's health. It is health. We're just using technology to optimize what we're doing. So it needs to resonate within that, but it also needs to be governed by the appropriate rules that are already in place across the country concerning tech.
Yeah, I think this is an interesting point, and I also do think when it comes to things like the national broadband plan, we actually, by the way, worked last year with Novartis Foundation and the Broadband Commission on the first report on digital health that the Commission put out, and the focus was on leadership and governance. And as part of that, we looked at governance models in digital health and what you see when you look across various countries. And one of the things we found in many countries, it is in fact led by the Ministry of Health, and that you tend to see that in lower resource environments. But it's a quite common model. But another model that you see in countries like Malaysia is a model where there is an implementing ICT agency. And by that I don't just mean a Ministry of ICT or a Ministry of Communications that sets standards, but an actual implementing agency that is capacitated to help various ministries within the government, not just health, but looking across various sectors to implement their digital plans and actually have the capacity to not only develop the strategies, but actually to help them implement these projects. And there I think you see just a faster rate of success when you have an agency like that. Within the government that actually has that capacity. There's always going to be a role that private sector vendors are playing in that, but I actually think that's one of the best ways to bring together the digital health strategy with what else the country is doing in broadband and IT generally.
Yeah, I think. I think the day we look forward to is when this topic has lost its novelty, and when it is just considered part of the business of running a health system. That there would be that digital tools would be part of that system. We're not there yet, but we will get there. And it's most health strategies will have pieces of information use, whether it's a paper record or something spelled out in that strategy. And all we're doing, we're substituting a new tool. Instead of pencil and paper, we're looking at ones and zeros. And it creates efficiencies, and that's why we hope that or at least we hope they will create efficiencies. And that's why we want to invest in these. It makes it possible. The promise of this technology is there, the allure is there, but at some point it has to become just part of doing business. And I think when we realize that, I do have to put in a plug for the director of our Office of Health Systems, who says, you do realize that there's a lot of paper and pencil going on out there still. So I think we also have to recognize that getting everybody on the same page is going to take a while. But at some point it has to be simply routine business.
Great, so I think we've got about 5 minutes left, and I thought maybe we could give the panelists each a last opportunity to make some final comments before we close. Who's going to start?
Josh. Go ahead. You talk like a minute.
Right, you love talking, come on.
Go ahead.
PPPs, remember this, it's a partnership. A partnership would only work when there's trust and there's respect. Trust and respect. Donors bring a humongous amount of money into countries. True, a huge amount of money, hundreds of millions of dollars. But all that money would not do nothing if some governments did not build facilities, if some governments did not employ staff, if some governments did not pay salaries, low they may be, late they may be. So if you look at it that way, it's not all one-sided. And the same thing should happen when the private sector gets with the public sector. There's learning that can move in both directions. And if they both realize they're both operating in that same boat, it's in everybody's interest to try and paddle in sync and in the same direction. Partnerships is trust and respect you need to build.
Yeah, I think one of the things that in looking at this topic, and especially the topic around PPPs, that I think we definitely, as countries transition, I think we need to adjust our orientation and our expectations for what the private sector should be doing, what the role should be. I think there's been maybe an expectation that as donors step away, the private sector will fill the gap. I think they can fill an important gap that exists right now, which is a capacity gap, a business gap, a technical knowledge gap. I think we have to be measured about the expectation that you're going to fill that funding gap in a one-to-one way. So I think there's a lot more that can be done there, and I think we have to get more creative about the models that we use to engage the private sector in these in national digital health initiatives and strategies. But I think we should also have measured expectations for what that's going to look like.
I would just say that we don't know yet what the role of the private sector will be in the next decade, and as donors, it is our responsibility not to close any doors whatsoever, because you don't know who's going to come knocking. I think it's important. I think it's also important to realize that the public-private partnership is a very powerful tool, but we have to remember that there has to be a goal, and the goal is not to form a partnership. That's day one. The goal is to achieve mutual goals. We want to partner with the private sector to achieve something together. And if our eye is on the ribbon cutting and not the good result that's going to come a few years later, then we've made a mistake. So those partnerships need to be really predicated on what do we want to see in the next 2 to 5 years? What do we want to accomplish together? And I think if we frame it that way, we will accomplish a lot.
Well, many thanks to our great panelists here today and for the audience. So I think we're done, right? Thank you.